far as that concerned?
Well, I think that there is a lot of shame. That's the stigma. And so you think that it's something that somehow somebody should be able to control. It means there's something defective about you, there's something wrong with you. But again, it's just like any other illness or condition. So just like years ago, maybe people were shamed by cancer, or people were shamed, HIV AIDS is something that we've talked about, and it's one of those things that over the years people are more willing to talk about, but it takes a lot of education. So I think that family members, like I said, we have an information and referral line. There's always the 211 number for United Way. There's a crisis helpline that you can also access. And so, talking to professionals, if you go to a mental health professional, there is confidentiality. So if your family member is scared, you can say, as long as you go to a professional, that person is bound by law to not reveal what you say to them. The other thing too is I think the clergy is a huge resource in our communities, and a lot of times people feel, if I go to this person and I reveal what's going on in my family, are they going to judge me? And I think that's why we need to educate the clergy to know how to respond, and that's part of what we do, and that's part of what you do, to see the example, to say, this is happening in our communities. We have to take the leading role. And so I commend you all, because just having this conversation on this show, somebody's going to watch this and say, oh, wow, somebody else is going through this. Somebody else has experienced this. And a pastor to be open, honest, and talk about something like this is happening in my family, and I need help with it, I think goes a long way. And as far as the jail, what you mentioned earlier, I think it's important for people to know there are about 2,400 people in the jail on any given day who are receiving psychotropic medications. So these are people being treated for some sort of mental disorder. That's a huge number. And actually, the number in the jail that are getting treated is usually bigger than the number of all the people in our state mental health hospitals. So, and that's 10 of them. So we have a huge situation as being, the largest city in the state. Of course, we're going to face these problems. And one of the saddest things ever is to have a mother tell you, and I've had this, my son was never as stable as he was when he was in the jail, because in the jail they've got it set up, and you can access services once you're in the system. You're in jail, you're in prison. The hard part is that before you get in there, accessing services is very difficult. When you get out, accessing services is very difficult. So whatever gains you've made while you've been in the system, you lose them when you come out. So we have to commend our sheriff and the people who work in the prison, in the jail here, because they really are doing an extraordinary job with the situation. But you can only do so much, and Harris County spends about $27 million a year on providing mental health services within the jail. And so what we're saying is, if the state cuts the funding for access to services outside the jail, we're going to have even more people going in there.
Oh, yes.
That's right.
Even more.
The state spends a lot of money on what we call competency restoration, and that's when somebody goes into the jail, they're found not competent to stand trial, they have to go to a state hospital, get competency restoration services. A lot of these people are getting booked on petty crimes. They're trespassing. It's a symptom of their illness. And so you're getting people who are, again, supposedly getting stabilized, but as soon as they come out, the resources aren't there. So cutting community-based services, which are essential to keep people stable, to keep people productive, healthy residents, doesn't make sense.
No.
And you end up paying more in the long run. So this idea that we're somehow saving the state money, it's ridiculous, because everybody pays more. And locally, you're going to pay more in your local taxes. So we pay taxes at a local level, at a state level, at a national level. We're going to pay for it one way or the other.
Now, I don't mean to take over your show.
It's okay.
I want to ask
okay.
a question.
It's okay.
Now, we're talking about cutting the funds. What could you tell to this audience, this viewing audience, while they are contemplating cutting the funding? What would you suggest to the public that we could do as a church, pastors and other pastors, other people in the community? What can we do that we can assure that there will be some funding there, such as maybe programs, fundraisers, anything like that? Would you suggest something like that?
I think, support your local nonprofits. Local nonprofits, I think, pick up so much of the slack and pick up so many different things that, when money's running out through state programs, where do people turn? They turn to churches, to local nonprofits, to schools. The other thing, too, right now is that schools are facing huge budget cuts. We already have an issue with a lot of counselors in schools are unable to do counseling because they're doing administrative work. So programs, that come into the schools and provide assistance, like communities in schools, those funding dollars are also partly on the chopping block. So I think what residents really need to do is, again, talk to their elected officials. Right now, the Texas House passed its version of the budget last Friday, well, over the weekend. It's a very scary version. The cuts are in there. You know, it's a very lean budget. Now, you know, the Senate side is going to be passing their version out. Their version looks like it's going to be better. So what we really need people to do is to just keep advocating to their elected officials and saying, I want this funded. You know, I want my schools funded. I want my mental health services funded, because this is what's going to happen if it doesn't. And so, you know, with elected officials, you really do have to give them some political cover. You know, they need to hear from their constituents so that they can say,
Right.
Exactly.
people in
Very
my
close.
district are worried
Exactly.
about this. I can't vote in a bad way on this because people in my district are going to hold me responsible.
Exactly.
You know, and like Representative Coleman always tells people, it's about priorities. So what are our priorities in the state? Is it helping the sickest of the sick? Is it getting our kids a good education? Is it providing them the support services they need so they can get a good education? Or is it, you know, building highways or whatever else,
Exactly.
Exactly right.
you know,
yeah.
other
Exactly.
people might think.
Exactly. You've enlightened us so much,
Yes.
Lillian. I mean, so much, because a lot of things that I did not know, and it looks like what we need to do is get busy, like you say, and start calling our representatives and just stay on them. I mean, this is not something that you say, well, today we're going to do, and tomorrow we
Right.
forget about it. If anything is to happen, you have to keep going. You have to keep going with it. And just to go back to what Pastor was talking about, why people, the stigma. A lot of people, when you say mental illness, they're thinking it's not like a cancer, because they say you can cut a cancer out, and you're okay. It's not like diabetes. Okay, I'll take my insulin and I won't eat certain things. But when you get to the mental illness and you start messing with the mind, people have a tendency to think that nobody is going to care. Nobody is really going to pay any attention to them. And when you start thinking about mental illness, I can see how some people would. They just don't want that stigma on them, because it's like, oh Lord, I've lost my mind, and nobody is going to care. It's not like all the other ones. Like you said a while back, cancer was a thing, but now they've got chemo, they've got things that they can help that, and what people that have mental illness or people that have it in their family need to know, just like they have insulin
Amen.
for diabetes, and they have chemo and radiation for cancer, they have treatment for mental illness too. Because I was reading just on your site how that they are out there. There are drugs, there are treatments out there for them, and that these people can live a comfortable life if they admit. But you got to first come forward and admit it, and that's what we, as as concerned citizens, we need to let them know. Yes, you just come forward. Something can be done. Yeah, you might be on medication, but if you were diabetic, you'd be on insulin.
That's right.
Maybe. If you had cancer, you may have to take pills. If you're HIV positive, you may have to take drugs for a long period of time. Well, why not do the same with mental illness? But it's just how they put the stigma. I mean, we just got to get rid of the cliches and the little bad remarks that they say.
Exactly.
We just got to get rid of that, because that draws people away. That stops people from coming forward. Oh, she's just bipolar. Oh, just crazy as a bug. And I have to admit, I've said those things. Not in wanting to hurt anyone, but when you start talking about mental illness, those things hurt.
Yes, it does.
And especially when you don't know who you're talking to.
That's
Supposing that person you're saying that to jokingly may actually have that problem. So we need to remove that stigma. And Robin, you work so closely with people, and you're out there. And I appreciate all the work, all the work that you do. Again, I thank you for inviting. This month is going to be a good month for us, because we've got some good topic. We're going to stick with our topic that we have, and we've got some good people coming on. For this month. So I'm real excited, as well as pastors. We're real excited about this month to bring this out in the open.
Yes, ma'am. And I like to wave in when I met Tracy Patterson first. And if we as a community would just network and go to things, if, like her event with Andrea Yates at the memorial, to remember her children. I met Lillian, I met Tracy Patterson, I met Andrea's husband. That he was willing to come out to the African American community so he can help us remove that stigmatism. We must remove that because we are one of those people that, oh no, don't tell anybody. My family is perfect. There's only one perfect man, and Reverend Nash is the man of the cloth, and we know that's Jesus. Because if we were perfect, then we would not pray. And we cannot allow this to keep going on. Just as she was saying in the jails, they medicate them, and then I'm a diabetic, just like you were talking. Okay, I'm insulin filled every day. You take that insulin away, I'm going to drop dead. And when you leave those prisoners out of prison, and when they don't have that medication, you just can't snatch that medicine from them. Then they come into the community, and this is a really true statement, you guys. The police come, they're acting up, they're acting out. Nobody knows why. The medicine is gone. Then they draw. It may be just a pencil, but then the police shoot them. Then we want to go, oh, they showing brutality. No. She said, call your congressman. We know what's going on. So it's our responsibility to do something to keep that medication going. You send a psych person back to the street. That's just like taking a baby when it's 2 months old and taking away the bottle. That's crazy. So we got to stand our children in the schools, children with special needs. We do not need to have our children's school budget cut. Honestly, start with the top. Terry Greer, cut Terry Greer. Give the money back. Give it back to HISD. Give it back. All those bonuses that those teachers are getting. I'm going to offend someone with this, but I'm passionate. We have our children in need. That's first. The Bible tells you about the children. So you take back and give to our kids, shipping them from, you live in Zone B, they're going to close the school. Now you got to go to Zone D. You got to start over, make new friends. Teacher got to understand you. Don't you know that's psychological? Correct, Lillian?
Yes.
And we need to stand up, not just talk about it. Get your community together. You bang their doors down because they think I'm crazy for real, because I will blow up a phone for my community.
We've got, it sounds like of all that we're saying here, number one is education. We got to educate our people on what's going on. We need to educate them. And that's not only me, but that's our officials, that's everybody. We were talking in the back that even with the police, you got to educate them, on what they're, what's happening out there. So education and advocacy is the big issue here. And as concerned citizens, we have to do that. I'm going to pause for a minute, Lillian, because this show is actually airs on a Hispanic show, and I would like for you, in your native tongue, to speak to them, because there's going to be some of them that's going to be watching this, and just to let them know what we're talking about today, because I want everybody to know that this is this is something that affects everybody, not just us, not just us. It affects everybody. So, would you speak to that audience out there and let them know what we're talking about today?
Okay. Hoy estamos hablando sobre la salud mental y los asuntos relacionados con la salud mental, la educación, abogacía, básicamente educando a las personas para que sepan que problemas de salud mental son cosas que nos suceden a todas las familias, que no necesitan tener vergüenza o no buscar ayuda, que sí existe ayuda en la comunidad y que hay personas con quienes pueden hablar, hay doctores, hay tratamientos, pero lo que pasa es que muchas veces en nuestras familias no queremos discutir este tema. Y es muy importante saber sobre este tema, pero también estar dispuestos a buscar ayuda e información. Entonces, ahorita estamos dando un número de teléfono donde pueden llamar y hacer preguntas, buscar recursos y les pedimos que por favor, si es un problema en tu familia, si es algo que les interesa, que llamen.
Okay. Pastor, and we don't want to forget the church.
Yeah.
We don't want to forget the church. because the church plays a vital part.
Amen.
We need to, the churches need to talk to their people. And since we have our pastor here, we're going to let him, we've got just about a minute left here. I want you to talk to them
Okay.
and tell them
What I
about
want
the
to
church.
say is this: that from the church standpoint, we minister to people with, according to Jesus, met many people with mental problems. A young man that was sleeping in a graveyard, a young man that having fits in a temple. But from that standpoint, this particular problem, mental illness, affects everybody. If you can't get the people to the church, still have people that have problems that need help. Now, from this standpoint, what I would like for you to do is tell this audience that this is something that can happen at a moment. It's nothing that builds up over time. Sometimes something tragic can happen. The next thing you know, you got this mental problem. Tell us, does that happen to everybody? Do it build or whatever? How is this?
It's different manifestations. There are some people that, maybe they have a predisposition to an illness and something traumatic happens in their lives, and that's when it really starts to manifest itself. Some people, when they were children, they had some sort of behavioral issues. And I want to mention what we talked about earlier. You cannot talk about mental illness without talking about substance abuse. So there are a lot of people out there who their underlying problem is a mental illness, but they've been self-medicating for so long that everybody says, oh, they're just a drug addict, they're this, they're that. There are reasons people turn to drugs and alcohol. So a lot of times people will say, well, they had a happy childhood. You don't know what's going on.
That's right.
You don't know if it's been something that's been building for years. You don't know if it's something that just manifested itself, 2 weeks ago. Many times it's a combination of things. And so that idea that, that I'm 35, so it can't happen to me. It could happen to you tomorrow. It could happen to your loved one tomorrow.
Okay. This has been a great show, and we want to thank Lillian for being with us, Robin and Pastor. We've had a good time today, and we look forward to next week's show, where we'll have Patrick McAvane, who will be here with us, and he will be talking on mental health. So thank you all for joining us.